This is Future Fork, a show that explores the world of food and the decisions we can make today that will shape our future. On the show, you'll hear from innovators in the food space. We'll have disruptive conversations with people from around the globe who are taking the lead on topics like food sustainability, ending world hunger, food security, and so much more. I'm your host, Paul Newnham. In today's episode, I'm joined by Dr. Lawrence Haddad. He's the Executive Director of the Global Alliance for Improved Nutrition, or GAIN. And we're going to unpack the state of global nutrition in a very challenging funding environment. You'll hear about the state of global nutrition funding after a year of major aid cuts, the role that small and medium businesses play in feeding low and middle income countries, and Lawrence's reflections on 30 years in the sector. Let's get into it. Lawrence, welcome to the show.
Great to be here, Paul. Thanks for having me.
Well, Lawrence, you and I have worked alongside each other for many years. We've seen many things succeed. We've seen challenges. We haven't always seen eye to eye, and we've had a number of healthy and robust differences of opinion, but we've always agreed on one thing, that no one anywhere should go to bed hungry. What drives that belief for you?
You know, thanks, Paul. And I think we agree on many more things than we disagree on. But when I was an undergraduate student, I kind of had an intellectual interest in hunger. How could there be so many people who are hungry in the areas that produce so much food? But it was only really when I went to, I would say, when I went to India as a young man and saw for the first time kids that were skin and bone, kids that were coming up to me and begging for food. This is in the early 80s. You know, it fused my brain, my gut, and my heart into something that was, you know, unbreakable. That unbreakable sense of hunger and malnutrition. It's not about access to food. It's not about access to anything. I mean, it's about those things, but primarily it's about access to power, and it's about justice, and it's about equity. And so when you have access to power, access to justice, you will have access to the food you need to stave off hunger and allow your body to thrive.
You shared the 2018 World Food Prize with David Nabarro, and after he passed last year, you called him a friend, a mentor, and a hero to you and to millions. What's your favorite memory of David?
I guess my favorite memory was one of the, and I mentioned this at his memorial in Geneva. It was one of the first sort of instances where I'd done something that actually really could have really riled him up. I'd invited a journalist to come to this Transforming Nutrition short course that we were running at the Institute of Development Studies. And SUN was just starting up, scaling up nutrition, and David was the convener, the coordinator of SUN. And the journalist said, well, do you think SUN's going to work? And I said, you know, very naively and honestly, well, it depends. I don't know. It depends on how seriously people take it and how well it's run. And then the next week in The Economist, the headline was leading development economist at IDS questions whether SUN is going to work or not. So, you know, I immediately thought, God, David is going to absolutely kill me. But he rang me up and he said, you know, he could have said, what the hell are you doing, Lawrence? He just said, you know, that probably wasn't the smartest thing to do. Be a bit wiser about the media. Write your own headlines. Don't allow the other people to write the headlines for you. So the fact that he was wise and not angry and was giving me constructive criticism was a really great memory, actually.
No, it's amazing. I mean, David had so much hope and tireless dedication. If you had David walk into the conversation right now, what do you think he'd be telling us about the state of nutrition in 2026?
Don't give up hope. Work together and be constructive. And I think he'd be telling us just because people don't want to fund nutrition per se as much as they used to, find ways of getting nutrition into the conversation and into the budgets. If it's if it's if it's climate, if it's jobs, if it's security, we don't want those people, those champions, to do nutrition a favor. We want to do them a favor by building in nutrition and showing them how it can create jobs, how it can mitigate climate emissions, how it can improve climate adaptation, how it can reduce the propensity for people to want to migrate. I mean, hungry people are restless people, right? Hungry people have less to lose in conflict. Hungry people have less incentive to maintain the environment. So let's make sure that we show them that we have something valuable to give to them. And I think he would say, get out of your comfort zone, challenge yourself.
So you've been working on malnutrition issues for over 30 years. When you think back over your career, what's changed when it comes to the main drivers of malnutrition in the world today?
Well, I think the face of malnutrition, first of all, that's very kind of you to say 30. It's more like 40. But you're a gentleman. I think the face of malnutrition has changed dramatically, right? It was 40 years ago. It was wasting, so kids being thin, stunting, kids who are 8 look like they're 5. Now it's the faces of malnutrition are many much more varied. You see obesity, diabetes, hypertension, chronic diseases basically that are fueled by poor diets, raising their heads in every country, even in countries where they haven't managed to reduce stunting and wasting to the levels that we would like to see. So, in terms of the manifestations, they're very different, and the drivers are much more complicated than they ever used to be, really. In the 20th century, it was essentially about lack of adequate food, lack of adequate sanitation, lack of adequate care, lack of adequate clean water, and lack of adequate healthcare. Now it's more diverse. It's all of those things still. They're all really relevant. And many of them are relevant to all forms of malnutrition. I mean, at the core of all forms of malnutrition is poor diet. It's not the only thing that matters, but it's at the core. But now you have to worry about things like urban planning, trade, a whole range of things, environmental sustainability. So it's the thing that keeps me going and keeps me intellectually engaged in nutrition, as well as the gut and the heart, is the fact that I think people who want to combat nutrition have to be fantastic development specialists because they have to be able to think laterally. They have to be able to see how that issue that seems to have nothing to do with nutrition actually is all about nutrition. And I think the diversification of the manifestation of what malnutrition looks like has just accentuated that.
Large scale food fortification is part of Gain's bread and butter. For listeners that have never heard of it, how would you explain this concept in plain English?
Yeah, I mean, fortification is now 25% of Gain's portfolio, and it used to be about 80 or 90%. Um, and I thought it was really important that we diversify as an organization because while fortification is one important way of improving the quality of diets, it's essentially a floor below which we don't want anyone to fail. It's a platform, if you like, for other types of diversification. So we want people to eat more fruits and vegetables and pulses and poultry and eggs and chicken and fish, these kinds of foods. That kind of transformation and change takes decades, really, because it's wrapped up in income and behavior and the food system and transaction costs and the middlemen and a whole range of things. So fortification, especially large scale fortification, which is essentially the addition of premixes, which are mixes of vitamins and minerals, to foods that people eat every day. So they could be cereals, it could be edible oil, it could be salt. These are foods that they eat every day, they already eat. They don't have to have any big behavior change to get them to eat these foods. They're affordable, they're acceptable, and when you add micronutrients to them, vitamins and minerals, iron and zinc and vitamin A and vitamin D, you are really increasing people's access to consumption of and absorption of these essential vitamins and minerals, which are essential for the prevention of so many diseases. You're also actually doing it in a very environmentally efficient way because many vitamins and minerals come from animal source foods, and animal source foods, of course, have a environmental consequence in terms of emissions and other environmental footprints. So it's actually a really efficient way of getting micronutrients to people who have low incomes. It's also really efficient because it leverages the private sector. Because while governments can set the standards, can set the mandates, can say, these foods have to be fortified, and they can maybe facilitate some of that work. Essentially, it's the big private sector companies and the small ones as well that have to add the micronutrients, have to monitor it, have to brand it, have to sell it, and have to process it. So it's really efficient in terms of the premix doesn't cost much, the private sector delivers it, and people don't have to change their behavior. And the benefit cost ratios are kind of off the charts. They're 50 to 1. Every dollar you invest or peso or rupee is you get 50 back in terms of economic productivity. I didn't know much about it before I joined Gain. My sense was that it was just add and stir. You add the premix and you kind of stir. But there's obviously a lot more to it. And it can be done like anything. It can be done really badly or it can be done very effectively. And that requires a lot of enforcement, maintenance, quality assurance, quality control. And then you need to actually assess whether these foods have been consumed or not.
Is there a country where large-scale food fortification has had a genuine impact that you could share?
I think any of the big countries that we work in, Gain tends to work in large population countries because large scale food fortification has this ability to scale rapidly. So Gain's target with our partners, our target is to reach of over 1 billion people with fortified foods, and we've met that target 3 years into our 5-year strategy. And the big countries that have really succeeded in this are Pakistan, Nigeria, Ethiopia, Bangladesh, big countries, populous countries, and they've managed to internalize and make this happen. Bangladesh is really an extraordinary case. The policymakers are so committed to this, and they've invested, and the private sector are so committed to it because the government have incentivized them to do this. So no, it's I'm always surprised when I see the number of countries that do not fortify. We call them vehicles, the foods that carry the micronutrients that and support the micronutrients. And every country really should have a law that says for these four food vehicles, whether they're cereals or edible or salt, for these four food vehicles, there should be a law. And if you think there are 193, 195 countries, you multiply that by four, you should have laws that cover nearly 800 vehicle countries, right? I think the number of laws that cover vehicles and countries is about 100, 150, if you know what I mean. So the potential to do much more is huge.
And I know you've mentioned that this is only one part of improving diets around the world. The State of Food Security report told us in 2025 that 2.6 billion people are unable to afford a healthy diet. So what do we know about the quality of diets around the world from the Global Diet Quality Project?
Yeah, I mean the Global Diet Quality Project, Gain is again only one of the partners, and there are several funders of that important thing. But I think it's a massive game changer. When I started out as a researcher at IFPRI, we used to be sitting around on the edge of our seats waiting for the next diet survey numbers to drop. And when they did drop, they were usually 5 years out of date. And it's because it was really expensive to collect information on diet quality. So this methodology, which has been pioneered by Harvard and Gallup and Tufts and Gain, really says we can get diet quality for 0.5% of the price of what it normally costs, and we can get the numbers within 4 weeks of actually asking the surveys. So it's incredible. And you do this by asking 29 yes, no questions. And the beautiful thing about this survey is that you can have it for men or women. It only works for people above the age of 15, and so we're working on a methodology for kids below the age of 15. But the really nice thing about it, Paul, is that it doesn't just measure undernutrition, it measures other types of malnutrition. So we can look at, for example, as countries' incomes increase, you can see two things happen. The consumption of foods that protect against obesity and diabetes and hypertension, that consumption goes up. But the consumption of foods that also promote obesity, diabetes, and hypertension also go up. So you can see this double-edged sword. So just put very simply, too many people are not eating enough food. Too many people are not eating enough of the right food. If they are eating enough food, then it's not the right food. And then too many people are eating the wrong food, junk food, basically food that's very high in salt, sugar, and fats. And these are foods that promote all the things we want to, that, when I go to any country and give a talk in any country, the first thing I say is, do you know that diet-related risk factors are five, usually it's five or six of the top 10 risk factors in your burden of disease in your country? Smoking might be up there, environmental pollution might be up there, HIV might be there, but five or six of the top 10 risk factors will be related to what you eat. And I think that usually blows people away. And diets are pretty awful. We have a big job to make nutritious foods more available, so in the market, in the fields, more affordable, and actually more desirable, because sometimes they're available and affordable, but they're seen as poor people's foods. Walking around Tanzania a couple of years ago with the team, we were trying to get more nutritious foods into the mouths and hands onto the plates in Tanzania. You see all these green leafy vegetables everywhere. They're like weeds. And so what are these green leafy vegetables? Why aren't people eating these? Well, our grandfathers and grandmothers used to eat them, but now they're considered to be goat's food, right? So we spend a lot of time revalorizing, rebooting foods to say, well, this food is available, it is nutritious, it is affordable, it can be prepared in exciting ways. And we work with, just as you do, we work with chefs and food preparers to show people how to make really tasty, delicious foods from these nutritious, affordable, available foods. So it's a big challenge, I think, and there are challenges in each step. Agricultural research and development tends to be not focused on nutritious foods. So that's a big problem on availability. On affordability, these foods are not very affordable. So the government needs to procure more of these foods for its schools, for its safety net programs. That then provides the private sector with a source of demand. And then on the desirability front, it's really hard to compete with junk foods. In Indonesia a couple of years ago, again, you go outside of the health clinic, the community health clinic, and big bags of junk food, with yellow puffcorns or whatever they are being sold for a fraction of the price, and they're in beautiful, wrinkly, crinkly, shiny packaging. They last forever. They're indestructible. They're very tasty. How does that compete with something that takes a bit more time to prepare, doesn't have the consistency, doesn't have that moorish quality? It's a challenge, but you have to tackle those three things in an integrated, combined way.
I mean, Gain works with small and middle enterprises or SMEs, and they're often an overlooked actor in our food system. There's groups like Millers, who Fortify Staple Foods are a key example, but you also talking about many of the countries that you've just used as examples. Why are these SMEs that nobody talks about so important for fixing global nutrition?
But they're really important, Paul, because that's where most people who are vulnerable to malnutrition get their food from. These SMEs, whether they are, as you said, millers, processors, retailers, transport, storage, they're all really important in getting food. And of course, let's not forget farmers are also small and medium enterprises, right? So getting food from farm to market at the production, the middle of the value chain, and the market level, these are all small and medium producers, and they understand the consumption needs of people at risk of malnutrition. They know where they are, they know what they can afford, they know how to make it attractive to them. And yet it's very hard for them to get access to finance. They're too big for microfinance and they're too small for formal finance. So no one will really take a bet on them. And yet these small and medium enterprises, they can shape their local food systems. They can be the future of local food systems. So we again think it's very, not just us, many others, think it's very important to support them with technical assistance. How do they formulate their foods to make them more nutritious? How do they market them? How do they develop business cases around them? But also to get them access to finance, whether it's loans or equity. And so we spend a lot of time doing that. We've set up something called the Nutritious Foods Finance Facility, which is the first blended finance impact fund for SMEs in nutritious space. It operates only in Africa. We're working now with the Asian Development Bank to see if we can set one up in Asia. And I think, this is what we need. We need to get finance to these guys. Policymakers also don't pay much attention to them. So they don't invest in things that would help small and medium enterprises, like innovation hubs, like finance that can work for them, like small roads that are really important for them. So I think the nutrition community has also kind of ignored these groups as well. The nutrition community, when they hear the word private sector, the phrase private sector, they think big multinational food corporations. And yes, they are important, and yes, they do lots of damage. But there are many other parts of the private sector that we need to be leveraging, especially now in this space where ODA is so precious and has so many alternative uses. We must use ODA to leverage private sector finance, but not finance for nutrition programs. It needs to be nutrition actions that can bolster the business case. If the business case is not being bolstered by nutrition, it will just fail. So how do we make nutrition a bankable, investable thing that improves the bottom line? Workforce nutrition is a really good example where you provide nutrition to workers. It's good for the workers, but it's good for the businesses because the workers are more loyal, they're less absent, they're less sick, and they're more productive.
Just on the finance, N4G Paris 2025 raised over 30 billion in a very brutal funding environment where nutrition's been hit harder than most. What does the sector look like in 5 years if this trajectory continues of funding challenges as we go forward?
So, Nutrition for Growth was brilliant given that USAID dropped out of the picture. I think we managed to actually slightly increase the commitments from 2021. But I was just reading the Global Nutrition Report proofs the other day, and I don't think I'm giving anything too much away. They basically said, look, the commitments were brilliant, but the delivery on the commitments a year later have been pretty terrible, actually. I think we need to be very alive to the fact that it's easy to make commitments, it's difficult to deliver on them. I think the space in 5 years' time is going to have to be much more diverse, much more creative. Necessity is the parent of innovation and invention, right? So we have to think really hard about how do we leverage the private sector, how do we leverage development finance institutions and international finance institutions, the so-called DFIs and IFIs. The development finance institutions are developed country and, of course, African and Asian public development banks. They tend to invest or give loans to the private sector. And then the international finance institutions, the multilateral development banks, the regional development banks, they invest in governments and give loans to governments and the private sector a bit as well. But those institutions need to change. They are much too risk averse. We talk to them a lot and they'll say, well, we don't invest in nutrition because it's not in our mandate, or because it's too complicated, or because there's no pipeline, or because there's no metrics. So, these are all these issues are, or because the scale is too small. We need to attack these. We can't. The nutrition champions can't just accept that. We have to work with the DFIs and the IFIs to make it easier for them to invest in nutrition and more attractive. And so I think we're going to see a much less cookie cutter approach to nutrition, and I think that's really good. Actually, we need to be nutrition gorillas, right? We need to find ways of sneaking nutrition in here and there and making nutrition work for other development outcomes as well. We keep saying nutrition is essential for 12 of the 17 SDGs. Well, let's put that into practice.
Before I come to our final question, just last thing, what's one thing that you think is just the most misunderstood in this space that you just wish people would really get?
I'm continually amazed that this happens to me all the time. People say, yeah, but we're dealing with hunger, so therefore we're dealing with malnutrition. This happened to me in the Food Systems Summit. I think some very senior people were asking me, what's the difference between hunger reduction and malnutrition reduction? And I think some other work that Karen Smaller and HISAT are doing, HISAT 2030, which is a big new scientific initiative, I think it's really clever because they're saying, look, you can reduce hunger in a nutritious way or in a non-nutritious way. So I think that's narrowing the gap between these two things. But you can reduce hunger just by making staple foods that don't have many other nutrition components other than calories cheap. And of course, that's a good thing, but it's a missed opportunity because you can also make other nutrients cheap as well with a little bit of imagination and a little bit of policy alignment. So I still spend a lot of my time telling ministers of agriculture why improving the productivity of cereals is really important, but don't spend 99% of your budget on R&D on cereals. Spend 70% of it on that, but spend the other 30% on vegetables, fruits, beans, poultry, fish. I would say that's the thing I keep getting confronted by.
So I always like to end with a question that I ask people about. What's a food memory that's really shaped who you are today?
It's actually a really difficult one for me, but because I grew up in a pretty income constrained household. So I remember the foods my mother cooked for me were very simple. But she was always really struggling on how to find good food at a low price. And she always managed to do it. She always managed to do it. Whether it was eggs or baked beans or fish fingers, she found a way to find relatively healthy foods that were inexpensive. And I found her resourcefulness kind of amazing. And I think that's always made me think that resourcefulness is a very underrated thing. And so, yes, it's much harder to find a healthy diet when you're earning $2 or $3 a day. But some mothers and fathers manage to do it, and some don't. So, what can we learn from the mothers and fathers who managed to do it?
Well, thank you, Lawrence, for joining me today, and thank you for the work that you and your colleagues around the world are doing at the forefront of really helping to ensure nutritious food is available for all. So thank you so much.
Thank you, Paul, again for your valuable work and getting these stories out and making complicated issues accessible to people beyond the echo chamber that we tend to live in. Thank you so much.
You've been listening to Future Fork, a show that explores the world of food and the decisions we can make today that will shape our future. Future Fork is produced by Disruptive Consulting Solutions and supports the SDG2 Advocacy Hub. For more info, head to the website futureforkpodcast.com. This show was produced with strategy and production support from Wavelength Creative. So you don't miss an episode of Future Fork, make sure to subscribe to or follow the show in your podcast app. And while you're there, leave us a 5-star review. It really helps others find the show. I'm Paul Newnham, and I'll see you in the next episode.